I'm Geoffrey Braithwaite. I'm Professor of Health Systems Research at Macquarie University, and I'm talking today about international health reform. It's true to say that academics and researchers produce a lot of written material, often in the form of books, and quite often in the form of textbooks. And frequently these books tackle a problem like culture change. How do you improve culture? Or policy. How do you get policy into practice amongst difficult circumstances? So we chose a different way of tackling this book that I'm talking about today, and that is, what does success look like? It sort of changes the paradigm to one where we're going to celebrate successful implementation in health systems. So I'm very interested in health systems, and I'm very interested in how do you get reform of health systems, and what does success look like when it comes up ground up, bottom up. So we invited 161 authors across 60 countries, each to tell us one success story in their health system. Health systems, of course, can tell many success stories, but we wanted people to focus in their chapter on one particular example. We've assembled those stories into a large doorstopper size book, covering those 60 chapters, covering the pearls of wisdom from those 161 authors. The book contains examples of success against great odds in low, middle income and high income countries. In China, for example, the success story chosen was about an IT, implementation technology implementation. In Venezuela, it was about getting primary care through to ghetto situations where people have very few resources and yet, paradoxically, need more healthcare than those in richer suburbs or richer countries. In Canada, it was looking at stroke patients and how accreditation, setting standards and improving things helped stroke care. In Australia, it was how do you get in inpatient settings, in hospitals, immediate response to patients who might be starting to deteriorate, and getting a medical response team early to them before they deteriorate and perhaps even die. So these are the kinds of success stories we have. And from those success stories, we've distilled 4 key lessons. One is the acorn to oak tree principle, which is most successful projects start small and then build up with the aim of eventually spreading right across the health system. Another one is the data to intelligence principle. You start off with data and then work up to turning that into intelligent information so people can make smart decisions. A third one is what we call the many hands principle. You can't just engender change, create change in complex health systems by one heroic person deciding that's the case, even if they're a very powerful person like a Minister for Health. You really need multiple stakeholders, many hands involved in delivering a success story. The final principle is you can't do any of this unless you have a good starting point, and the starting point has to be the patient. All of these projects really started with thoughtful consideration and often involvement of the patient. So the patient starts. That's the starting point for building a success story.